Muscles of the pectoral region. The muscle of the pectoral region is including many muscles. We have about four muscle. Pectoralis major, the biggest one. Pectoralis major. So if we have major, so we have another muscle named pectoralis minor, and the muscle under the clavicle named subclavius, and finally the muscles to the ribs named serratus anterior. Serratus anterior. We have four muscle. Every muscle you have to mention the origin, insertion, and the nerve supply and action. Regarding to the pectoralis major, all these muscles named the pectoralis major. What is the origin? Number one here, clavicle, attached to the clavicle medially, then attached to the front of the sternum, and the upper six costal cartilage. This is the origin. And the insertion for this muscle will be inserted here in the humerus, exactly where in the humerus, in the lateral lip of the bicipital groove of the humerus. And please, you have to mention that any muscle attached to the humerus will act on shoulder joint. Shoulder joint. Any muscle inserted in the humerus, acting on shoulder joint. What are the movement of shoulder joint? The shoulder joint movement, flexion and extension, adduction and abduction, medial rotation and lateral rotation. So this muscle inserted in the humerus in the lateral lip of the bicipital groove of the humerus. طيب. What is the nerve supply of this muscle? The same name of the muscle, pectoral nerve. This muscle have double nerve supply, pectoral nerve. One is medial pectoral nerve, and one is lateral pectoral nerve. Now, what is the action of this muscle? The action, mostly the insertion moves toward the origin. The insertion move toward the origin. So please move the humerus toward the origin, يعني near the ribs and the sternum. So what is the action here? Flexion or extension? So I will choose flexion. طيب, this will adduct or abduct? Adduct. طيب, will move medial rotation or lateral rotation? Medial rotation. So the action of this muscle of the pectoralis major is flexion, adduction, and medial rotation. This muscle is very important. Why? Because this is one of the two muscle under the breast direct. So any cancer of the breast can invade this muscle, and you have to remove it. And the patient after the surgery will complain from weakness, inflection, and adduction and medial rotation. So the biggest one here, it is the pectoralis major. Regarding to the pectoralis minor, it is triangular in shape like that, and originating from the rib number 3. This is the origin. Rib number 4, if you wanted to see the pectoralis minor, you have to remove the pectoralis major first. And number 5, يبقى rib number 3, 4, and 5 ribs, and will go to be inserted here. This is the insertion in the coracoid process. Coracoid. The nerve supply only medial pectoral nerve. The pectoralis major medial and lateral pectoral nerve, but here pectoralis minor only medial pectoral nerve. So if anyone have fracture of the coracoid, which muscle affected? Pectoralis minor. طيب, what is the action? Number one, any muscle inserted in clavicle or scapula will acting on shoulder girdle. What is the action of the shoulder girdle? elevation, and the opposite is depression. Protraction, and the opposite is retraction. So this muscle, please move the insertion toward the origin. Depression or elevation? لا, will be depression. طيب protraction or retraction? لا, protraction. So this is the action of the pectoralis minor. And please take that any muscle attached to the ribs will move the ribs in respiration. Very important in respiration. بتعمل assessing the movement in respiration. This is a pectoralis minor. يبقى pectoralis minor here acting on shoulder girdle, but the pectoralis major acting on shoulder joint. Subclavius. The subclavius, it is a very small muscle from its name under the clavicle here and originating from the first rib to the under surface of the clavicle in subclavius groove. And the nerve supply the same name, subclavius nerve or nerve to subclavius. And what is the action? Fixation of the clavicle or shoulder during its movement, and also movement of the ribs of the first rib during respiration. B here, it is the biggest one, so it is the pectoralis major. If you remove the pectoralis major, you will find the three small muscle to the coracoid process like that. So it is a pectoralis minor, and any muscle under the clavicle will be pectoralis minor. What means by clavipectoral fascia? Clavipectoral fascia. Clavipectoral fascia. Fascia here, which is a fascia, it is a connective tissue, cover two important muscle. It is on envelope or enclose two important muscle. From its name, clavi, يعني subclavius muscle, and pectoral means pectoralis minor, not the pectoralis major, pectoralis minor. This is a white color here covering the both muscles named clavipectoral fascia. طيب, which is the important item here? This fascia is pierced from out in or from in out by important structures like what is called caul. Number one, C, يعني cephalic vein. This vein piercing the fascia from superficial to deep, and the artery also pierced from deep to superficial. It is named the acromiothoracic artery. يعني supply the acromion and the breast and the thorax, and also the nerve piercing it to supply the pectoralis major. What is the name of this nerve? Lateral pectoral nerve and lymphatics finally. So we have many structures piercing this clavipectoral fascia. The last important muscles under the breast also, يبقى we have two muscles under the breast, pectoralis major and serratus anterior. Serratus يعني irregular edge, يعني like the teeth in shape or finger in shape, have many finger like that. This is a pectoralis. If you can see from the side view of the ribs, this is the serratus anterior, and originating from upper 8 or 9 ribs. يبقى originating from upper 8 or 9 ribs and will be inserted, go to be inserted here in the scapula behind. Exactly where in the scapula? The ventral of the medial border of the scapula. The ventral border of the medial border of the scapula. طيب, what is the nerve supply? Very important, long thoracic nerve. This is nerve descending over the muscle here. It is named long thoracic nerve. So this muscle inserted in the scapula, so acting on shoulder joint or shoulder girdle? No, shoulder girdle. Shoulder girdle. So protraction or retraction? No, pro. Why? Because it pull the scapula, the insertion toward the origin. So it pull the scapula toward the ribs. So it is protraction. The main protractor of the shoulder, the main protractor of the scapula. It named also boxing muscle. Very, very important. طيب, any muscle attached to the ribs, so respiration. And also keep the scapula in contact with the thoracic wall or chest wall. The last important action, put the arm or the hand above the head. يعني making the abduction more than 90. We have degrees in abduction of the shoulder from 0 to 15, from 15 to 90, and above 90. Above 90, we have two important muscle, which is very, very important to put the hand above the head. Trapezius and serratus anterior. Which muscle put the hand above the head? يعني means abduction more than 90, serratus and trapezius. So this nerve is long thoracic nerve. This nerve is longothoracic nerve, most commonly injured during fighting, but a knife on the side wall of the chest, or during the removal of the breast in mastectomy, accidental injury of the nerve during a mastectomy, and will lead to paralysis of serratus anterior. So, what happened during paralysis of serratus anterior? No, the scapula, the medial border of the scapula will go backward and forming projecting like that. If you ask the patient to push the wall, the medial border of the scapula is projecting backward like that. So it is injury of the long thoracic nerve, which is named this deformity winged or winging of the scapula. Winging of the scapula. And what is the root value of the long thoracic nerve? What means by the root value? يعني originating from where of the spinal nerve? From the cervical nerve number 5 and 6 and 7. Poland syndrome means absence of the pectoralis major, partial or complete on one side, like that. Thank you so much.